Welcome to DadTalks. It's powered by Duchini. It's available across all the Centerpoint stores here in the UAE. My name is Tarun, and what we're going to talk about today is something which is extremely important for all the young parents, old parents, and older parents. It's such an honor to have Dr. Vipul Agrawal in the studios of City 1016. He's from Prime Healthcare. He is MCH, FRCH Urology. Thank you so much for taking your time out and coming down.
Thank you, Tarun, for inviting me. I would like to take this opportunity to say hello to all your viewers and hello to all the wonderful people of this wonderful city. A small thing that I would like to thank the leadership for taking so good care of us in different difficult times. And over to you.
Thank you very much for that. And I know that these small little messages, they create a huge impact. Now, Dr. Vipul will deep dive into it. We are talking about something which is related to all the children of all the ages, and especially when it comes to me being a young parent, it's something which has been on my mind, especially being a parent to a daughter. We're talking about urology. We're talking about, the excretion as per se. Now, what are the basic questions that normally parents come to you with?
So, if you talk about children or about parents, there are wide variety of patients that I get, starting from really small ones like 1-year-olds and up to even teenagers.
Oh, wow. Okay.
With varying problems in different ages and similar problems but different ways of presentation. So the earliest thing that people find is when they are not able to do proper cleaning of the genital part, and that's for people who have not been circumcised for religious reasons, and they end up kids having UTIs or bad genital hygiene, which may require a medical circumcision. So if the parents are properly taught, especially the fathers, because this is something which should come from fathers to their kids, if they are infants by mothers, but when kids grow older, by the fathers to their kids about proper genital hygiene, none of the kids will require a circumcision.
But so we are talking about kids being boys here.
Boys,
okay.
Yes.
Yeah.
Now, apart from that, about girls as well, a few basic health practices or health habits need to be inculcated in both. I've started seeing now kids, because we've been hooking on to tablets, phones, and all these devices. And gone are the days when I was really young and we would have only Doordarshan. Now you open your TV and you have things available 24/7. Even my kids, I see, they are hooked to the television as if they are virtually dead. So they don't move, they suppress their senses, which leads to them suppressing their signals that their bladder may be full, they need to go and empty the bladder or pass urine. And over a period of time, as they are continuously growing, they are suppressing these sensations. That is for boys and girls both. So now we are seeing kids, or rather than young adults in 20s, who have trained their bladder in such a way that the bladder has forgotten to pass urine normally, and they end up in dysfunctional voiding, urinary incontinence, recurrent urinary infections, and stones, which are these complications of abnormal voiding habits. So these things should be taken care by parents very early in their age. And it does not mean that you scold your child, you just tell them, counsel them the benefits of proper urinary hygiene and time passing of urine. It's just a habit that you need to tell.
Okay. Now, this was a brief description of everything that we're going to talk about. Now,
Yes.
let's talk about the first aspect of it, which is called urinary incontinence.
Yes.
What exactly that is, and it can be seen from which age to which age?
So, urinary incontinence means leakage of urine. Now, if you talk about kids, because since you are also a recent father, and congrats to you.
Thank you very much.
So, the most common thing in kids which is seen is enuresis, which is a kind of urinary incontinence, which is in common terms is called as bedwetting. Now, bedwetting is when the child passes urine while he or she is sleeping. And a lot of parents come to me, they are panicked, they have tried whatnot, and then they are still not able to manage. Now, as embarrassing it may sound to the child and to parents, it is not something to be worried, because up to 80% of kids, as they grow and reach teenage, probably mid-teenage, which is around 15 years of age, they will not have it. So even if your child has been having incontinence in bed, like bedwetting or enuresis, there's nothing to worry. You don't need to be really, of course, you need to counsel and talk, but it's not like it's something which is a permanent thing. How will we manage when he grows up? He'll be an adult or she'll be an adult, marry and all. Most of the teenagers by the age of 15, they are off in enuresis and they are having a normal sleep without any lack of confidence or embarrassment that they don't want to go out with friends because they might do some problems when they're sleeping overnight.
Okay, now when it comes to them getting to the teenage and be okay with it, but what is the age gap where you would deem it to be normal?
So toilet training starts around 2 to 3 years of age. I would say it is a bit more normal when it has continued that there is a delayed toilet training, so which is called as primary enuresis, when the child was never dry after toilet training. Secondary enuresis is when the child was completely dry, he or she was able to hold urine overnight without any troubles, and then he or she starts developing bedwetting. So that is a bit more important thing, or a bit more not serious, but something which should not be overlooked. So if the child is having primary enuresis when he was or she was never dry, it may be just a bit of a delayed developmental bladder training. But yes, if it's a secondary enuresis when the child was absolutely dry for at least 6 months or more, the parents should be concerned. They should seek a doctor's help and discuss.
6 months or more dry.
Dry means no bedwetting in the night.
So isn't that a good sign?
Actually, it is fine, but then if it is coming back after 6 months,
if it's
that
coming
means
back
it
after
becomes a
6
bit more serious.
Okay, because it was fine for 6 months,
Yes.
and now again the
Then
control
there is a
being
problem
lost.
coming up. Yes.
Okay. Now I'm gonna go back to the question: what age to what age it's deemed to be normal?
So actually speaking, bedwetting is never normal, but till the child is fully bladder trained, like even if you are having a child in the daytime and you don't need to, when you stop asking, putting him on diapers for the fear that he may not be able to tell for urination and use the toilet, that is the time it should be normal. Sometimes the night time may come a bit late, so parents are it's normal for the kids or the parents to wear a diaper at the night, but the time when your child has become dry in the day is approximately overlapping with the time when the child should be dry in the night as well.
I get that. I'm talking about what age to what age.
Say around 3
So
to 4
age
years.
bracket.
3
So
to
for
4 years.
example, 2 to 6 is normal.
Yeah, that I would say easily.
So 2 to 6 is normal for
Yes.
them to
Become dry. Start
to become
becoming dry.
Start becoming
Yes.
dry. So that is the time when bedwetting should reduce.
It should be stopped.
It should be stopped before the age of 6.
Yes.
Realistically.
Yes.
Okay. I'm going to ask you this question again. And what we're going to do is we're going to talk about just the age bracket because we've repeated a bit. So, Dr. Vipul, what is the age bracket we are talking about when it comes to the bedwetting to be reduced? From what age to what age?
Every year, around 10% of kids start getting reduction. Like, so if there are 100 kids right now in a pool or a study group or in a class, if say 60 are around having bedwetting at the age of 6 years, so every year around 6 kids out of them will start developing normal. So every year around 10% of the kids start becoming normal. So
Okay.
that is how it progresses, and that's how by teenage almost all of them are dry.
Almost by teenage.
Mid-teenage.
By mid-teenage. Okay. Now, is there a psychological impact to urinary incontinence or is it just physical?
So actually speaking, it is a biological phenomena which includes a lot of factors like hormone disbalance. When you have hormones in the body which make more urine and you have hormones in the body which conserve water and not allow you to make urine because if you are dehydrated. So your disbalance in these may contribute. Deep sleep, which is one of the very common factors, kids who are really deep sleeping, because most of the parents who come with kids with bedwetting, they say the child passed urine and still was asleep. He didn't know that he's lying in a pool of wet bed. So that is one of the reasons. It could be a small bladder capacity. Having said that, I do notice a lot of kids who are worried. I won't say stressed, but worried because of any reason. It could be a very, very simple reason that, for example, the difficult times that we are right now. So if the parents are talking about the situation and all those things, the kids may get anxious, and this sometimes may be a manifestation of their anxiety. So whenever I get kids who are having these problems, irrespective of the age and whether boy or a girl, I make sure that the parents talk to the child, because the first thing apart from having a psychogenic component is support. So if a child is having these problems, even if it's a biological reason, the first thing is a psychological support by the parents. Ki don't worry, it's not something embarrassing, it's not something to be worried about. You will become normal for sure. That's what the doctors are saying. And it is just a matter of time that you will outgrow this trouble and be as good as normal. So even if there is not a psychogenic component, support from parents, from siblings, even at times from school teachers is of paramount
Oh,
importance.
wow. Thank you very much for that. Now, here's the question. All of this is going to work out with time, as you said, with parents after discussing. What is the first red flag that, parents need to go to a urologist and figure out this is not getting contained?
So first, of course, like I told you, if it has come back after a dry phase of at least 6 months, the parents should be a bit concerned. But then again, if it is persistent to the same frequency, like almost every night, they end up changing child's clothes because he or she has passed urine in the bed, or it is increasing, like at times there are kids who do it twice. So like they slept at around maybe 10 o'clock. 1 o'clock, mother went to check, she found the child is wet, she changed the clothes. Again at 4 o'clock, she finds him or her to be wet. Okay. So if they are noticing that it is not at all changing in the frequency, it's almost every day, or in fact increasing to multiple times even in the night, is when they should come to the doctor.
Okay. And when it comes to the worst case scenario in this particular situation, are there remedies to correct it?
There are remedies. Thankfully, medicine is a very, very last option. Unthankfully, or rather unluckily, it is commonly tried as a first option by a lot of doctors, and I won't say qualified or not qualified, because whatever the studies have said, the recurrence or coming back of the problem after initial control is highest if you started with medicines.
Oh, okay.
So I have a practice probably in the last 5 years. If I have seen around 100 kids with these problems, though it's not a very big number, I might have given medicines to hardly 5. So
because that is the last resort.
Yeah, and most of the kids don't need it because not only it is the last resort, it is not the long-term answer. Okay. So a long-term answer is behavioral changes, lifestyle modifications, alarm therapy, which are a very important component, which have a long-lasting effect, and they help child grow psychologically as well and take care of his body and be more confident.
That is such an important topic to talk about.
Yes.
And I feel that, parents, ho jayega theek.
Unfortunately, it's very important and it is never discussed. The kids and the parents suffer both, more so the child, because many a times the parents may not be supportive, they may be just shunning it, or maybe at times scolding, which actually increases the trouble rather than helping them out.
It's a very important point for the parents to note, and absolutely not shunning it, and realizing how important it is not only for physical development, but how it affects your child's psyche. Let's talk about the remedies that we can do, like top 3 ways that parents can figure out at home, apart from having a communication with the child, which obviously is the first thing to do, with calm and peace, not yelling. What are the top 3 things that parents can do at home to keep a check on it or perhaps rectify it?
So the top 3 things are the actual 3 things that I suggest. Of course, the first thing is to talk to the child, ask if he's strained or stressed, which may be anything. As trivial as I want to come first in my class, but another boy or girl is outshining me, so that may be a reason. So they should talk to the child. Some lifestyle changes and modifications are needed. Like, so if your child is sleeping at around 10 o'clock in the night, so I tell them before the time of regular sleep, they should stop any fluid intake 3 hours prior to that. No tea, coffee, colas, chocolates, which increase the urination and the urine output around 6 to 8 hours prior to sleep. And the alarm therapy. Now, the alarm therapy is the central process or the key to treating kids and keeping them clear and no recurrence. Now, alarm therapy is, I ask the kids or the parents, what is the earliest time that they have passed urine once they went to sleep. So let's say if it is after 4 hours they pass. So they should put up an alarm at 3 o'clock, 3 hours post sleep, and the child should go. Now, commonly seen, because parents are also tired, what they do is they wake up, they try to wake the child. If he's not waking up, they will either carry him
Yeah.
or probably, not to say the word drag, but
Drag, yeah,
push
they do
him,
that, yeah.
not dragging in the
हाथ
bad
पकड़ के
sense,
ले
but
जाते हैं
yes,
अंदर, yeah,
exactly.
कि भाई चल सुसु
And
कर
then
ले, yeah.
make him do urine and come back. That is the wrong way to do it.
Okay.
And it leads to the maximum number of failures and disappointment. Doctor, we are doing alarm therapy, but it is not happening. So the proper way is you need to get up. You need to make the child get up. He should be awake. I tell them ki go wake your child. You sit on the bed, let him go to the toilet, pass urine, and come back. Because then he's fully awake. Because one of the reason may be deep sleep. So if you're not breaking his deep sleep cycle, you're not helping him out, come out of the situation. So the alarm therapy, if properly done, has the best results. And this is the core, that you don't wake up, you wake up along with your child waking up, going to the toilet, passing urine, coming back to the bed for sleep. So he should be fully awake to go to the washroom.
Such wonderful tips. Thank you very much. This is so
Minor
basic
details
and
only.
you know, no, it's God's in the details, and it's so wonderful the way you're explaining everything. And I think all the parents who are struggling with this right now, they would find it very helpful. So thank you, Dr. Vipul, on that.
And the best part is it doesn't need any medicines. So it is just trying to train your child's bladder and his sleep pattern so as to accommodate the episodes of urine.
Now, there was one more thing, you know, when we were growing up as kids, Papa Mummy कहते थे बेटा जब पहले सुसु करा फिर सोने जा.
Exactly.
Is that one thing that can also be added to
yes,
the list,
yes,
that
yes,
let
for
them
sure,
go and...
for sure. So one of the things, like I said, no fluids before sleep, and of course emptying your bladder before going to sleep is very important.
Okay, so that kind of would regulate.
Yes,
better.
yes, yes,
Okay,
of course.
thank you. Now, we go into the other end of this conversation. We're going to now talk about UTIs, urinary tract infection, if I'm correct.
Yes, you're correct.
Now, when it comes to youngest age and the kind of cases you may have received quite regularly, what is the age gap we are looking at, and what kind of infections have you seen?
So urine infection, or commonly UTI in kids, is common in all ages, starting from a child who may be really newborn to all the way teenagers and even adults, though the reasons and the contributing factors may differ. So if you're talking about really small children, let's say maybe up to 2 to 3 years of age, most of the times it is some congenital anomalies, or like abnormalities in the way their kidneys developed when they were growing in, and it may be some fallacies in this which hamper the proper drainage of urine starting from where the kidney they make it and to the bladder and out. So in very young kids, like less than 2 years, it is mostly related to congenital anomalies.
Congenital anomalies
Means
क्या होता
since
है?
birth, since birth. So,
Since
so
birth,
like
okay.
we have 2 kidneys which pass urine through ureter in the bladder. So if there is some structural defect in this, which can be multiple, it can be narrowing, it can be inadequate emptying, it can be reflux, it can be dysfunctional voiding or neurogenic problems. So these are since birth. They did not develop it after they were born. So
And due to since birth wali, can they also be rectified?
most of them.
Okay.
Most of them can be rectified, and usually with quality of healthcare that we have, most of them are identified even before the kids are born, because we have, especially in this country, good antenatal care for mothers when they are pregnant. So most of these, if not all, can be diagnosed when the child is still not born. And the parents can be counseled about the need for medical attention, regular watch. They may not need surgical correction, but definitely they can be watched and checked and treated before they cause some irreparable damage.
I'm sorry, I'm going to cut you off here one more time. I know that, you know, we are going to discuss UTI further, and we're going to talk about different ages and the way we were progressing. But before that, when it comes to a particular age, are there different symptoms or similar?
So actually the symptoms are different because the communication ability of kids are different.
Okay.
So a child who is around 10 or 15 years of age will be able to very specifically tell, I'm having troubles, I'm having pain in my urination. It may be genital pain, it may be abdominal pain, it may be fever, tiredness. But if you look at a child who's around maybe 5 years or 6 years, he may not be able to communicate all these things. And a child who's around 2 months or 2 years may not be able to communicate anything at all. So the pathology is same, but the symptoms depend on the communicability. So many a times the patients may be brought, the children may be brought by their parents, he's having fever, that's it, nothing else. They didn't notice anything, he's not crying or anything, and it's just fever, and when it is evaluated in detail, they find it to be urinary infection. Sometimes they may come with he's crying when he's passing urine, or he may say he's just crying because the child is wearing diapers, so whenever he's passing urine, he's crying. Right. So they are not able to notice that the crying is associated with urination because it's a painful urination. So that can be a symptom or a bringing complaint by the kids. They may find blood in urine, the genitals may be dirty, or there may be foul smelling urine, it could be a turbid urine, it could be a lower abdominal pain that when I'm trying to touch, he's crying like these things. So it can be a lot of things.
What is a turbid urine?
Turbid means unclear urine. So urine should be crystal clear like water. When you can say foggy urine, like air is foggy, it's not clear. So turbid is when it will have some suspended particles or unclear.
Okay. So these are the symptoms that could be seen with time and, like you said, communicability. Now let's get back to the discussion that we were having, from what age to what age.
So that's what when I talk to you about infants and really small kids. But then as the children grow, there can be multiple reasons. Like we discussed before, proper genital hygiene is important. The kids should take a daily bath. If they are not circumcised, they should know how to clean their genitals. Girls should be knowing how to clean their genital part. And a very important thing is constipation. Because what happens is, like I told you about the kids trying to neglect their desire to pass urine when they are hooked on to these gadgets and all, it happens same way for toilet also. So when they feel like they need to empty their bowel and they're feeling like I need to go and pass stool, it happens that they tend to suppress that feeling, which leads to the bowel being distended, and it sort of causes thickening in the bowel. So if you're holding urine in your bladder or stool in your rectum, it is giving extra work to your bladder or bowel, which leads to like a gymming effect. So your bladder becomes thicker because it's got extra load. So you're giving him unnecessary exercise. And then when the bladder or the bowel becomes thicker, it becomes a bit less sensitive. So it will not give you all the signs and symptoms, and it may lead to increased urinary infections. And you may not know that you are constipated, and you may feel I'm fine because your bowel has stopped taking signals that it is distended and it needs to empty. So constipation again contributes to a lot of urinary infections, especially kids who are from toddlers, you can say, or you've started walking, to even adults and even older people. So these are other reasons. And then of course, less water intake, junk food, all these things, kids play, they run around, and when their water intake is less, it will again contribute to urinary infection.
There are so many aspects to it. It's like a huge field. And as a normal man, as a recent parent, and everyone who obviously, has gone through a journey which is similar to what you have just mentioned, we don't even realize.
It is big, but then small habits, which just, I tell all my patients, parents, that don't do something out of the blue. Just remember the habits that your parents have put into you. Like you said, कि मम्मी पापा कहते थे बेटा सोने से पहले यूरिन पास कर ले. So just try and bring those habits into your kids. So if your kid is busy watching TV or on the mobile, many of the parents are comfortable because if it's work from home, he's not disturbing me. But then, like you are taking a break from your work from home, doing a 2 hours, okay, I'll do a stretch out. Make sure the child also puts down his gadget, even if it's an online class, takes a break, goes, drinks a glass of water, empties his bladder, and comes back. These are the minor things that they need to do, which go in a long way in keeping the child healthy for now and when he grows as an adult.
Okay. Now we're going to get into the hygiene aspect of it and kind of deep dive into it. I remember that Alana had some diaper rashes, and you were worried that it may be UTI. And obviously when you hear UTI, you get scared because, symptoms are very painful for a child and they can't even explain it to us. So let's start from girl and then move on to boys. Now we are looking at the age from 0 to 2.5, 3, because she's already been toilet trained, and we are making sure that when she wakes up, she goes and sit on the toilet. But that is majorly for the potty training. Abhi urinary training nahi samajh aaya usko, aur usme time lagega thoda. So when it comes to the hygiene aspect of it, we were told to put pseudo cream on the genital area. Is that correct way to go about it? And of course, like cleaning it properly, regularly with wet wipes. But does something like this would stop bringing in rashes? Is it the right way to go?
So all these creams and all are a very personal suggestion. A lot of doctors advise, sometimes I do advise, but then it's my way of practice and your way of practice may be different and both may be correct. So as per what I advise is, you don't need to put any extra cream. The most important thing, and that is for boys and girls, especially when they are on diapers, is to ensure that their diaper is not soaked and wet. That is the most important thing. So if your child is on diaper, you will, as you are keeping a watch, or the nanny who's taking care of the child, or mother or father, they'll know what is the frequency of urination and how long it takes for the child to totally fill the diaper to get soaked. So just need to make sure that that is being taken care of, because a soaked diaper will definitely lead to rashes even if you're using a cream. So that is the basic most important thing. Apart from that, the child should be given a thorough daily bath, cleaning the genital area gently with soap and water.
Absolutely.
No medicated soap is needed, even for adults. And a thorough bath with cleaning the entire body is paramount to all parts of cleanliness hygiene. Same goes for the genitals also. Of course, when you are changing a diaper, you should see that, look for any redness or any blisters or rashes. If it is there at start, you should see a doctor to see if there is any medication needed, because these are early signs, and not wait for them to become really big and generalized. And make sure when you're changing the diaper as well, that you may have skipped an hour or so when you're changing, it is dry. If you feel the child is not dry, either dry him with a towel or let him stay a bit exposed so that the skin dries out. The skin should stay dry irrespective of how frequent you're changing the diapers.
Wow, that is a great tip. Thank you very much for that. Now we'll move on towards the boys. Like you mentioned a while ago, that there are so many factors that the circumcision doesn't happen. Number one, what is the need of it? Number two, is it actually the hygienic way to go?
So in this part of the world especially, circumcision has two reasons to be done. One is the religious circumcision and one is the medical circumcision. So kids who are circumcised for religious reasons, of course they still do need to take care of the genital hygiene, like keeping them dry, giving a bath, proper changing of diapers. But the kids who are not circumcised because of their religious beliefs, the mother and the father, especially the mother, should be told what is to be taken care of. They should be explained that the foreskin doesn't come back immediately, it is initially sticking, but with a daily bath you can initially start stretching it a bit, and over a period of time it starts retracting fully. Now what happens is, if the foreskin is fully retracting, skin sheds cells all over the body. We don't see because it gets washed out. Now if the foreskin is not retracting, those shed cells do not get dispersed and they accumulate, which leads to smegma, which is highly infectious.
Oh, wow.
So once you are able to clean and train the child, initially you yourself need to be trained, and then you train the child to pull the foreskin back completely and clean it on a regular basis. You may not need circumcision because you are keeping a way of hygiene, and if you have that habit, you may never need circumcision for life.
Okay.
So this is what is to be inculcated in kids. And apart from this, whenever they are passing urine, of course, when a child is around 2 to 3 years or even 4 years for that matter, he may not be going to the washroom to pass urine. He may be passing in the diaper, or you may be accompanying him. But once he has become independent enough to go to the urination, he should be taught that they should pull the foreskin back and empty the urine, so that there is no urine seeping in between the skin layer and the penis.
Wow.
So that will keep the area clean and avoid infections and need for a medical circumcision.
I'm so glad and I'm so grateful for your time. And because these are things that normally people are either too awkward to talk about or too worried to share. But I think this kind of conversation at this time in our lives, in our times, because awareness and exposure is equally both important for parents and for kids alike.
Actually, the problem is this hygiene habit should come from fathers. And many a times even fathers are not aware of these things. But even if they are aware, because mothers are taking care and
They are hardly involved. Yeah.
Exactly.
That's the reason Dad talks.
No, not hardly involved. But the mothers don't know, and sometimes they are a bit too scared because it's my child if I stretch and all.
Yeah.
So they may actually be a bit ignorant or not aware of the way to clean a child, especially a boy's genital area, and to train him so that he continues that for life. So whenever I see kids like this, I talk to the mother to reinforce, and I talk to the father also that you will be taking care of this and training him how to do that.
That's so nice. That's so wonderful in so many ways. Um, I'm gonna, now conclude this. But before we do that, could you please give 3 top tips to parents in a very short way, so that कोई भी अभी पहली बार हमें ये देख रहा होगा रील पे तो वो समझ जाएगा.
So 3 tips I would say is don't neglect signals. If you are thirsty, drink water. If you are feeling like bladder, go and pass urine. Don't overindulge into things where you suppress your body's hints or signals that you are wanting to pass stool or you're wanting to pass urine or you're thirsty. That's first thing. Good food, healthy food is very important because it builds up your body's resistance and strength to counter even if there are minor infections. And of course, the most important thing is help is available. We are living in such a wonderful country where everybody is having good access to quality health care, which is of international standard. So, and it's not always that if your child is having some trouble, he may be sick or he may need some tests or medicines or surgery. Just see a doctor. It may be just some doubts which may be cleared. You will be much more comfortable and confident in taking care of the child.
That's amazing. If you are even slightly concerned, reach out to Dr. Vipul. He's a part of Prime Healthcare with incredible experience and a wonderful know-how of this entire thing. While you were talking, I had another question, and that would be again related to incontinence. A lot of major chronic issues like BP, sugar, all of this leads to something which I believe is similar to incontinence. And what is it? Is it actually because of that, or like how can we make sure it doesn't happen?
So incontinence is a very big umbrella, which includes lots and lots of disorders with lots and lots of reasons and causes. I am trying by my Instagram handle to make people aware, because right from kids, what we discuss, to elderly, people do have urinary problems, which may not be incontinence, but start of abnormal urination and ultimately lead to incontinence with multiple reasons. And they are quite embarrassed to talk about it to their spouse, their family, if they are old enough with their kids or with their parents, and even to their primary caregivers like their internal medicine specialists or family doctors. And they keep managing it in a very embarrassing and underconfident manner, which may lead to have an impact on their social aspect of life, that they may say, doctor, when I go to the mall, I first look for a washroom before going to the movie. So the important thing is it is something which can be very easily managed. All abnormal voidings and incontinence, I would say at least 70% will not need surgery for sure. Around 50% will not even need medicines, just lifestyle changes and some modifications. So do see a qualified urologist, discuss with him in detail. He may not do some detailed testing, just a simple ultrasound or urine test and certain tits and bits over here and there in your lifestyle, and you may be back to your confident self. So a lot of factors, for example, aging, diabetes, neurologic diseases do contribute to incontinence, and it can be quite embarrassing and a bit awkward to talk to, but help is available. If you feel there is some abnormality which you are not happy about or you are a bit concerned about, see a urologist. He will be able to help you bring back to your confident self.
Wow. Thank you so much for that as well. And you know the urologist to get in touch with. He is in Prime Health. His name is Dr. Vipul. And thank you so much, Dr. Vipul, for coming down to the studios, taking your time out and being part of DadTalks.
Thank you, Tarun.
It was wonderful having you.
I would like to say that you are really doing a good job, because being a recent parent, especially if it's your first child, can be taxing, not only on your physical routine, but on your mental labor. But bringing these topics, you are not only helping yourself, but to a lot of new dads and in fact new mothers as well, bringing awareness and helping them understand the nitty-bitties of bringing up a child. I really appreciate your effort.
Thank you very much.
God bless you and God bless this wonderful city.
Thank you. Thank you very much, doctor.